Now, when you miss some of the appointments, the lymphedema gets worse, the swelling gets worse, and performing your daily activities get worse. Now, when you miss an appointment, when you're close to a threatened ulcer, now when you come in, you have ulcers. Now, for trying to alleviate venous insufficiency ulcers, of course, it can be a year to 2 years before you can get the ulcer to heal. And then sometimes we have reoccurrence of that ulcer. So we've had patients that missed the appointment and haven't came, and then they come back later. And when they come back later, now you're in the ulcer phase. It makes it more difficult, more challenging to fix. Same thing with the varicosities, with the varicose veins. The varicose veins always end up around the ankles to create venous insufficiency ulcers. Now, ulcers don't make you lose the leg. It's when the ulcer gets infected, and that's when you lose the leg. So it has caused more time at work, more time, and more financial strain on the patients when they miss those appointments and they develop ulcers. So we want to fix you before you develop ulcers. We don't mind fixing you while you have the ulcers, but it's more strain on the patient after they've had an ulcer.